So we've had 10 new cases overnight. 6 of them are locally acquired cases, 5 of them related to the second cluster, which I'm going to go into detail in a moment with. 1 we're still working out which cluster they're related to, but we know they are a contact of a case. So we have 6 linked locally acquired cases, which is good. They're all linked. Then we have 2 cases that were acquired overseas and detected in hotel quarantine. So both came from the Philippines via Papua New Guinea into Queensland. So they're fine and being managed. Then we have 2 other cases that are under investigation. So we're just working through those cases. We believe they're older cases linked to the first cluster. So now if I can go into detail about these 2 clusters. So the first cluster is related to that doctor at the PA hospital who treated a confirmed case, and you would remember that she acquired it from a confirmed case in the hospital, and also that case had passed it on to another traveller in the hotel when they were in hotel quarantine. So there were those 3 cases earlier in March, 12th of March. Then since then we now have these new cases that we picked up in the community, and I'm very grateful to that first young man who came forward and got tested, and the second gentleman, so they live in northern Brisbane. So those 2 cases, then we've had other cases connected to those. So, and we know they're all linked because of the genome sequence. They're all a B117 linked back to that case at the PA hospital. So we have that cluster. Then we have a second cluster, and this is the nurse that I told you about yesterday. So she worked at the PA hospital on the 18th of March in the COVID ward. But we now have the genome sequence result back due to some fantastic work by our pathology staff. They gave that result to me last night, and she has exactly the same genome, no SNPs different, to a gentleman who arrived and was treated in the PA hospital and was tested on the 22nd of March. So after the nurse worked in the COVID ward. She did do a shift on the night of the 23rd of March. So that shift started 10 p.m. that night. She worked through the night into the next day on the 24th. So my hypothesis, and this all has to be tested, this all has to be checked out, this is very preliminary information, is that she has acquired the infection when at work that night. Now, I don't know whether she's got it directly from that patient because she wasn't working with COVID cases that night, but we have to confirm that, or whether she's got it from someone else in the hospital. All that has to be worked through. But we do know she's got exactly the same genome, so we can't find the epidemiologic link at this stage. That's the work we are now doing. So she has got it. Then her sister has got infected with the same genome. So we have that genome sequence result last night as well. So we have the nurse, her sister and that overseas traveller, all with exactly the same genome. Then there are a further 5 cases that I've been informed of overnight linked to that nurse or her sister. So they're all linked cases, and they all attended a party together down in Byron Bay. So we're just working through all of those specific details. This is very recent information. So we have those 5 cases linked to that nurse. So we now have 7 in that cluster. Then there is another case. Remember I told you there were 6 new cases overnight, community acquired, 5 of them linked to that nurse in that cluster. Then there's another case that I still need to get more information, but I've been told is a close contact of a known case. So we don't have community transmission out there that we're not aware of. At the moment, all of our cases are linked to either the first cluster with that doctor who worked at the PA, or this second cluster, which is a brand new cluster unrelated to that first cluster, linked to the nurse who's worked at PA. So we understand all of those movements. But we've had a lot of people now out in the community infectious. So that's why we need this 3-day lockdown to get on top of all of the contacts of all of these positive cases and work out where they've been, and having everyone in their home instead of out and about in the community just helps us get on top of all of the contacts and minimise the risk of further spread. But we know we have had infectious people in the community, so that is why it is absolutely critical that anyone, anywhere in Queensland, because we do know that some of these people have left Brisbane, so it is vital. Anyone in Queensland with any symptoms, please come forward. That is critical.